In 2007, I was diagnosed with breast cancer. Part of my treatment was having to go to Calgary for 6 weeks for radiation.
I was diagnosed with prostate cancer. I had to travel to Calgary to take 35 treatments, which took 7 weeks.
I was diagnosed with lung cancer. Subsequently, I had to spend 7 weeks in Calgary to undergo radiation therapy.
A new era is dawning for cancer patients in southern Alberta. The expanded Lethbridge Cancer Centre allows people to get the care they need much closer to home. In addition to chemotherapy, the centre will now provide radiation therapy, marking the first time this service has been available in the province outside of Calgary and Edmonton. The $52.3 million expansion project, located within the Chinook Regional Hospital, allows hundreds of Albertans every year to stay in their community, comforted by familiar surroundings and the people they love, while undergoing the cancer treatment they need.
A lot of people don't realize that radiation treatment is very brief. It's 5 minutes a day, 5 days a week, often for many weeks. And so for those 5 minutes they're in the cancer center, but the rest of the day it's so much nicer to be living at home, having lunch with your family, having supper with your relatives, to be surrounded by your support system. And now we in southern Alberta have that.
I think the hardest part was being away from my home and my family. Also, there's things I like to do, like baking and cooking, that finds for me is very relaxing. And although I was comfortable where I was, to not have the access to my own kitchen or the pantry or utensils, that was really tough. I didn't have the way to release those anxieties that obviously you feel when you're going through something like this.
I'd say the hardest part is that breaking habits of the way you live, especially when you're older. That you have to leave home. You missed your books, and you, of course, always missed your conversations. And that you miss more than anything else.
My husband works full-time, so he had to drop off a child at daycare, pick her up. He had to get home, make sure dinner was ready, organize grocery shopping, whereas I usually do that sort of stuff because I'm a stay-at-home mom. So that's usually my job description, not everybody else's.
I think it will be a great benefit to these patients and their family and support members not to have to travel to access a treatment that they can now get in their home community.
The Lethbridge Cancer Centre will do more than minimize travel for cancer patients. The facility has been designed and equipped to provide the highest quality care in a patient-friendly setting. A CT scanner is on site for planning radiation treatment. 2 linear accelerators are located in Alberta's first doorless radiation vaults, which are less intimidating for patients and improve access for staff. The linear accelerators can provide radiation treatment to about 30 patients per day.
We have bigger examining rooms that allow us to meet with families as a whole, where they can listen in on what the conversation about treatment options. We have treatment rooms that are now individualized and allow more privacy. We've been lucky enough to have an exemplary nursing staff, an exemplary support staff who are very caring and have now moved into a facility where they can do their thing.
Although patients with certain cancers will still need to be treated in Calgary or Edmonton, about 80% of radiation treatment needs in the area can be done at the Lethbridge Cancer Centre.
This centre will be treating patients who have breast cancer, prostate cancer, colorectal cancers, and lung cancer, as well as palliative treatments.
All Albertans, not just those in the Lethbridge area, will benefit from the Lethbridge Cancer Centre.
The increased capacity that Lethbridge brings gives us flexibility, provincial flexibility. Now if we have an unusually high demand in Edmonton or Calgary, we can actually shift some work towards Lethbridge.
Alberta Health Services has plans to add more cancer care capacity. Radiation treatment facilities are expected to open in Red Deer in the fall of 2012, followed by Grand Prairie.
One of Alberta Health Services' primary goals is improved access to services for Albertans. The new radiation facilities are bringing radiation treatment closer to home for more and more Albertans.
It would have made life so much easier to be in my home doing those daily little things as well as getting radiation.
I don't know if you've ever been sick, but to be sick in your own home is way better than being sick someplace else. It's your own bed, it's your own comfy things around you, and even your own toilet to throw up into is a real big treat.
I still think that this is going to be marvelous to have the center here, and that's what I want to keep talking about.